Without further ado, I'm going to introduce Fiona Hanrahan, who is the Deputy Honorary President of the Irish Association of Directors of Nursing and Midwifery, to share with you this morning, and Director of Midwifery in Holles Street, a flavour of how the conference is going. And Fiona is going to then introduce our guest presenter, Cathy. So thank you very much, Fiona.
Thank you, Maureen, and good afternoon to everybody. It is afternoon. We were on the move since early this morning. As Maureen said, I'm Fiona Hanrahan. My day job is Director of Midwifery and Nursing at the Rotunda Hospital, not the National Maternity. The National Maternity has lovely Mary Brosnan. And I'm here today as Deputy Honorary Vice President of IADNAM. So the conference started this morning early. We've had a very busy and productive morning. I might just address the title of the conference, because I think it's a lot of words, and when I saw it first, I was thinking, gosh, no frontiers, people and technology, sustainable coalitions for success. But actually, when you break it down, each piece, no frontiers, well, nursing and midwifery has no frontiers, because we cross every part of healthcare. Wherever there's a patient or healthcare needs, you'll find a nurse or a midwife. People and technology, which was addressed this morning, very much about our professions reaching out and meeting the technology coming towards us. The horse is bolted, technology is there, and we're looking at how we can make care and technology work together. And then sustainable coalitions for success. I think that's hugely important with Sláinte Care and the RHAs coming up, that we work together in coalition, not in competition, for success for everybody and care for our patients. So this morning we started off with our President, Eileen Carruthers, giving a very I think a very heartfelt opening talk about the need to be brave in healthcare. You know, we're in 2022 now, a new era following COVID, all the learning from COVID that we have, and we need to just put that into practice, work together in coalition for our patients. Dr. Geraldine Shaw then spoke to us. Geraldine has OM&SD as her family, you know, including all the CMEs and NMPDUs and all the letters that go with it. But she's at a level where she can drive change and have the voice of nurses and midwives at the government table. She reports to the Chief Medical Officer, and she works very closely with Health. So she's a massively influential person, and gave us a very informative, a very informative talk about the roles and what they're doing there. So that was really informative. Unfortunately, we ran over time, of course, as you do when nurses and midwives get talking. And we then had a discussion around, I suppose, digital opportunities and the changes that are coming down our way, and how we can be better together for technology. We had a patient called Elaine Chillingsworth spoke to us. So Elaine had very invasive facial surgery, and she talked about her journey through that and having to have a prosthesis on her face. But actually the learning from that was the digital interventions that have now come with that to make things better for patients like her. And then we talked about the changes the electronic patient record is bringing to healthcare, and we had a sort of a conversation, a leadership conversation around introducing electronic patient records to a working hospital where you have patients. So, and we then had a really good session with a recorded session from the Minister for Health, Stephen Donnelly, where he talked about his plans for the future of nursing and midwifery, the investment, the report on nursing and midwifery and how that's affected us, and his commitment to increase the percentages of nurses and midwives in advanced practice roles up to 3%. And I felt very supported by him. I always find when Stephen Donnelly talks about nurses and midwives, he definitely has our backs when it comes to healthcare. So he seemed to see for us a very bright future. He very much thanked nurses and midwives for their work during the pandemic. But now he challenges us to bring all these changes forward. He quite liked the title of our conference and thought it sort of encompassed everything he's trying to do as well. So overall, a really good morning. We didn't have much time for Q&A because we just ran over time, and we decided to make use of the time separately. There's about 220 people here today, and they've all just gone for lunch, and we're going to try and keep the afternoon on time. That's the plan anyway. So thank you for that. So now, if I may, really excited to introduce you to Cathy McDonald. Cathy arrived in from Edinburgh last night, and Cathy is a police officer by background, I think, and her current role is a hostage and crisis negotiator. And actually, I love the title of her talk. It's how to communicate when, you know, the stakes are high and time is not there, which is just every hospital every day of the week. So I actually think this is what we can learn a lot from. So Cathy, thank you so much for talking to us today. And Cathy is also talking to the conference after lunch. So Cathy's about to get very busy.
I am.
So thank you very much, and I'll hand over to you.
Thank you very much. And it's after lunch, and I picked up loud and
No,
clear about
no.
keeping on time. That's actually the most difficult part. And today we have about 20 minutes. And I'm going to give you a whirlwind tour of the framework we use within hostage and crisis negotiation. It's actually my former world, although I'm still involved slightly. But that was a world that I left around 2015. But here's a whole load of good stuff that I'm going to be able to share with you. So within hostage and crisis negotiation, we deploy to any incident that a commander requests us to where communication blockages have happened. Now, they can be fast-moving, dynamic incidents such as suicide intervention. Someone in personal crisis was about 40 to 45% of our work. And at the other end of the spectrum, we would have, which was round about just under 5% of our work was kidnaps, and then everywhere in between. And as you can see on the next slide, our framework of communication was all about connect, understand, communicate, and when necessary, and in the main, was to influence and change behaviour. So if you think of it with suicide intervention, it's fast-moving, dynamic. We don't have weeks and months in order to, to solve this. We need to move quickly. And I guess it's a little bit like an emergency within your world, because you're skilled, you're trained, you're experienced, but actually when something happens and it needs immediate attention, emotion lifts in everyone involved. And therefore, there are certain elements within communication that comes to the fore that I'm going to speak about. Then at the other end of the spectrum, our hostage situation, it's slow time. I never want to call that job routine, but the consequence is massive, yet it does take us weeks, months, and sometimes years to get someone back. And then the communication is a bit more businesslike. Now, there's everything else in between, from renegade aircraft coming in to protest groups, crimes gone wrong, domestic sieges, and actually something that landed on our desk quite often was chronic complaints about the police. Not criminal, they went down a particular route, but complaints that had maybe been going on for a long time, and it looked like they were just going round in circles. There was no solve to them, and they would come to us. Can we look at it? Because there's communication barriers. So we were deployed to a whole range of incidents. Now, how does that happen? How is that going to help you today? Well, within that world, we have a communication framework that we can lean on for every deployment, irrespective of who's involved. So it's robust that we can lean on it, excuse me, but it's flexible enough to meet the needs of every single person we encounter. And I'd like to give you a whirlwind tour of part of that framework. Now, every element I'm going to speak about, starting with the next slide, which is about the law of approach and law of avoidance. Every part of this we can go into a great depth and coach, but we're going to do it on a time tight today. So this is it's fun, if I want to call it that. A bit like speed dating, what we call it, negotiation or communication speed dating. So first of all, at the forefront, really at the foundation of that framework, we have this little thing called the law of approach and the law of avoidance. And it was very simple. And if you think of it, the things you approach in life, the things that you invest time, money, effort, energy into, they're all things that you like. And psychologically and actually physically, you will approach these things. Now think about the things that you avoid in life. It could be bad weather, busy traffic, busy city centres, people you don't indicate. You'll know the things that you avoid, that you'd rather not invest any time and effort, and you actively maybe even avoid them. It's the same with people, and it's the same with communication. And if you think of it, I'm sure everyone listening just now probably has a conversation that they're avoiding having. So what's the importance of this? Well, we identified, and where we're coming from is we're supported by the world of academia, but everything I speak about is from a practitioner's perspective. So how we use this is that we recognise that while we create an environment of approach or cooperation, communication flows really well. Whenever there's an avoidance, it can't flow. And therefore, any ability to negotiate, change behaviour, influence, actually, it's going to be incredibly difficult, if possible at all. So much of what we would do is try to connect, build the relationships, and we'd think about quite creative ways of doing it. Use all 5 senses. And just think about the last time you met someone for the first time. What appealed to you about them, and maybe what made you want to walk away? That's exactly what I'm talking about here. So that's the first part. The next part, we're moving on to emotion. And you already will be incredibly emotionally intelligent. You will understand emotion. Being at the front line, being at the sharp end, you'll know this stuff. But if you'd allow me just to highlight how we use it within our framework, there's the acknowledgement that we all function on emotion, every single person if you're human. And that's a silly statement, isn't it? Every person if you're human. Oh, there'll be a few of them. Believe me, I'm more human than I care for at times. So every single person, we all operate on emotion, and quite often we'll communicate on emotion as well. But here's how emotion impacts on us. If I can ask you to think of a time where you were emotionally triggered, okay, that little seesaw is high, and think about your communication and compare it to now, where I imagine your communication is quite neutral. You're neither high nor low. At the moment, communication between us can actually flow quite comfortably. And if we click that slide, you'll see that that seesaw goes from high to a nice equilibrium. When that happens, just visualize communication flowing back and forward. When it is high, it means that communication can only go from the emotion to the logical. And immediately we identify that when someone is emotionally high, it's pointless speaking with them. We have to give them time and space for that emotion to drop down. So that's one of our times to listen. And we would use emotion as a barometer as to when to listen, when to speak, and when to offer a solution. And I'll speak about timing just to round off today. But first of all, emotion. If you compare these two things, triggered to balanced, our pace, pitch, and tone changes. Our word choice changes, and there's a filter, isn't there, between what we think and what we say, and sometimes that filter thins and maybe disappears, and then there's a direct link, and sometimes we deliver words that taste so good, but we know are going to cause us damage, and we have to go and repair just a few seconds later. Non-verbal, our facial expressions, the way that we move gives clues about how we feel. Our ability and our desire to listen, completely impacted by the intensity of the emotion. And of course, emotion works quicker than logic every time, which means it works quicker than our ability to cover up. Emotion tells you it's truthful, and it'll tell you how someone is every time. And even as an example, I'm sure you've all had patients who've said, "Oh, I'm actually fine, thank you." And you know they're not. You know they're not because of your experience in understanding and reading people, because there's something else going on there that says their words don't match the actions. That's emotion giving you the clues. So that's how we use emotion within negotiation. And the next slide is the one that I do want to spend a little bit of time on, if you allow me. I think I have about maybe 8 minutes to speak about this. If you take nothing more away today, please take this, because this is one of our major tactics that we used in every deployment. And in fact, we started using it in a number of other areas as well, which I'll share. Roger Fisher and Dan Shapiro were psychologists in the Harvard project, and they uncovered that as human beings, we all need 5 things to feel emotionally content and happy. Now that is 7.9 billion people on this planet. So those that you haven't even met yet, you're going to know something about them in about 5 minutes' time. Our colleagues, our patients, every single person, irrespective of where they sit within the business. Now, most business and organizations have a hierarchical approach. So you have the CEO or equivalent at the top, you'll have practitioners at the big bit of the triangle, and you'll have middle management and specialisms in the middle. And that's the way businesses really operate very, very well. But when it comes to communication, communication cannot be hierarchical. Think of the best people you've ever worked with. It doesn't matter where they have the position within the company. They have credibility and respect for that. But their communication is, well, I'm guarded to say flatlined because that's my world and I know that's not good in yours. But communication is this balance of just the human connection. We need to communicate as human beings, and that's what we did within negotiation, irrespective of who we're dealing with. And that was incredibly important. Now, Roger Fisher and Dan Shapiro highlighted that as human beings, we all, every single person needs these 5 things. So they're on the screen. 1 is appreciation. We all need to feel valued for what we do and for it to be recognised by those we expect to recognise it. Number 2 is affiliation. We need that sense of belonging, that we're connected, that we are around people that we can trust, that we can kick back and be ourselves, that vulnerability that says, it's okay, I can be me. We then need autonomy. Autonomy meaning that we have to have, we need a feeling of being in control, a freedom of choice, a freedom of speech, And we hate being cornered or stuck. And just think of COVID. I heard Fiona speaking about it. You're coming out of it, and it's a new time for you to take what you learned. Well, just think, what did we learn in COVID? We learned what it was like to be stuck and have no autonomy. And we need autonomy, and we strive for it. And then we need status. Status is number 4. We need to feel that we matter, that we're important, not for what we do, but for who we are. That when we walk into a room, we're noticed. When we walk out of a room, we're missed. And then the final one is our role. We need to know that we have a purpose, a goal to work towards, a purpose in life, a purpose each week, and maybe even every single day. Think of how you feel on a day where you have been super busy, and then you go home and think, I didn't get anything done. I feel this has been such an unproductive day. And it's annoying, it's frustrating. And compare that to a day where you achieve everything you want and your to-do list is ticked off. And there's a feeling of achievement there. That's when we need that goal. We need to be able to work towards it, and we need to achieve things to make us feel balanced and content. So that's a whirlwind explanation of core emotional concerns. And what I'd like you to do is to put them into context. Think of your happy place. Think of where you would like to be right now and who you'd like to be with and what you're doing. And if you think of it in terms of core emotional concerns, you will know that they're all balanced. You will invest time, effort, psychological energy into wanting to be around that area. You want to be with these people. They fulfill your core emotional concerns. And if you compare that to a time where you were maybe, well, let's say it, we've all got them. We've all got people and situations in our life that we never want to be around again. And if you can think of that in terms of core emotional concerns, the best one is, have you ever left a job that you just did not like? And if you think of it, you probably did not feel valued and appreciated, connected to the team, freedom of choice. You maybe weren't clear of your role, or you end up having to do more than you were ever expected to do. And maybe you just didn't feel important. You could come into work and maybe feel that nobody noticed. Think of these situations you've avoided or left in terms of core emotional concerns, and it gives you a shortcut to make sense of situations. And that's how we would then use core emotional concerns. Now, on the next slide, it gives you a pictorial explanation of core emotional concerns. Each of them, imagine when they're filled, when you feel happy and content, each of your core emotional concern buckets are full. And when you are triggered, as soon as there's an emotion change to the negative, so frustration or anger, some of these buckets are beginning to empty. Now, the good thing is our normal coping mechanisms mean that we fill our own buckets most of the time. We have a coping mechanism. Just think, even when an email comes into your inbox that annoys you, well, how do you deal with it? You maybe have a shout, you maybe, roll up the sleeves and the heavy keyboard reply starts. We have coping mechanisms. Sometimes our coping mechanisms, if we ever feel overwhelmed, our coping mechanisms are not serving us well, and we can go into a little bit of a personal crisis. Now, the good thing about core emotional concerns is you can fill your buckets from a different route than emptied them. So it doesn't have, as long as you feel appreciated somewhere, your appreciation bucket will fill up. It'll maybe take away the pain of feeling unappreciated elsewhere. I know that sounds very simple, and that might spark a lot of questions, but I'll tell you where you might be able to get some more answers about this shortly. So the next slide really captures the essence of core emotional concerns and how we can use them. First of all, we don't only need these. We actually migrate to environments that fulfill core emotional concerns for us, i.e. you leave a job you don't like and you come to a job that you do. And it means that this is a formula for creating calm and stability and retention amongst your staff. If you can fulfill core emotional concerns in your team, they will stay with you and want to, and the discretionary effort will come in where you'll get more from people than you ever pay or expect them to deliver. So core emotional concerns, the question at the beginning that Fiona asked you, when was the last time that you felt properly heard? And it doesn't happen very often, where you really know the person opposite you has grabbed exactly what you mean. Well, actually, the quickest way to fulfill core emotional concerns is to feel properly heard. So if you can give someone time and show that you're really giving them time to and try and understand not only the information and the stuff they share with you, but how they feel about it and the little clues that tell us what's actually really important to them. If they can know that we're listening for them, core emotional concerns will take care of themselves. Now, on the next slide, I'm going to show you just a few of the situations that we dealt with where we consciously used core emotional concerns. Suicide intervention, we'll just use that one as an example. And if we know that if I'm walking towards someone who's on the edge of a high place, I can already expect that their buckets are completely empty. They are in personal crisis and their normal coping mechanisms are no longer serving them well. I don't know why they're there, and I probably can't repair their whys, but I can start to make them feel valued and appreciated and connected and important from what I do and the actions I say. It's the same with a hostage. They're going to feel in personal crisis. When messages are woven into them from family and friends, how can we make sure there are messages that support core emotional concerns? Some of the things that we did. We then adapted, and moving on into the world of business, if you like, we actually started adapting them within our everyday work. And as an example, I used core emotional concerns as a template for staff appraisals. How appreciated do you feel at work? Is there something I can do to make it better or worse? Is there anything I need to be aware of? On a day you don't want to come into work, what's happening? Tell me, and I guarantee it fits into 5 core emotional concerns. You now have a tactic that gives you a communication shortcut. It helps you make sense of something and a template that you can use quite creatively. Now, there's actually been a bit of work going on, and in the next slide there are QR codes, there are links, and Winnie Ryan and Professor Peter Gillen, I've been working with them over the last 18 months. They are responsible for this program, a communication program, and they gave me an insight into it, and it's absolutely excellent. There's one module that that I worked on with them that's all about core emotional concerns, and it's centered around maternity. And if you can link into them, it gives you some material that you can use and perhaps use with your teams. I'm meeting Winnie here tomorrow, and if you want to ask Winnie Ryan or speak to her about the whole communication program, I'm sure she'll be delighted to show that. So we only have about 3 minutes, and I'd like to round off just with a few other things within our model of negotiation. And on the next one, you'll see I speak about, move on one more, please, if you will, is just core emotional concerns is the stuff that's predictable about us all. But you might be sitting there thinking, well, I'm different from someone else. Well, we're all different, all 7.9 billion people on the planet. And if you've ever asked yourself, why do people say what they say and do what they do? And you might even think, how come they are such an ass? How can they be so difficult? And the answer is exactly the same, because they can and because it works. So if you ever encounter someone who is autocratic and maybe bullyish, well, why are they like that? Well, A, it's enabled. Something allows that to happen. The environment, the culture, the lack of response. And B, what is it they get out of it? And that's a question we would ask ourselves a lot, especially within kidnap. Why do they do that? Why do they threaten that? What is it that they're doing and why? And what is their real why? And can they achieve the same feeling through a different route? And can we help them with that? So if you have somebody who behaves a particular way that's unhelpful, start thinking about them as an escape room and a puzzle. Why do they say what they say and do what they do? Because they can, because it works. What is it that's working for them? And try and work that out. Now, I know there's quite a few steps to get to the crux of that, but that's the essence of it. And on the next slide, you'll see that the basis is that we're all in our unique bubbles. No one has had a life experience like you. We all are unique. Thankfully, we can see and hear through each other's bubbles, so we can speak to each other. But if you've ever thought, why doesn't anyone see this the way I do? It's because they're not you. It's as simple as that. And when somebody else behaves or says something that makes no sense to you, well, they're working from their own bubble. It must seem okay for them. So here's the thing. Within our world, we had to put our biases aside. We had to create this feeling of appropriate curiosity. I wonder why. Even if it is, I wonder why they're an ass. And we have to work on what's going on here. And you then get an insight into values, beliefs, needs and wants, and they're all unique. We connect on our similarities and we conflict on our differences, and it's a matter of looking at similarities to try and progress us. And on the final thing we're going to speak about is timing. This comes all the way back to the first slide that we spoke about on emotion, and then the next slide we're going to round off on is about timing. And it's really when to talk, when to listen, when to offer a solution. Ask 2 questions, especially if you're in a position within the medical profession, the same as policing. Well, we're problem solvers, and sometimes we can jump very quickly to trying to help and solve a problem. And if we problem solve too early, it's like a comedian on stage trying to deliver a punchline. It doesn't land. So here's a little template that we used, and this is a practitioner's template. It's not supported by academia. It's just, here's the stuff that works. Before moving a conversation to problem solving, ask yourself, does the person really know that I have heard, understood, respected? Have I demonstrated that I'm getting where they're coming from? Even if I disagree with it, I get their perspective. And secondly, emotionally, is their seesaw flat? Because if it's not, they're not going to hear me. So if you can answer yes to both these questions, you can then go ahead with your solution. And that, ladies and gents, gives you a whirlwind snapshot tour of our communication foundations, which I hope there was a few things in there that you can weave into the amazing work that you already do and take away with you today. And thank you very much. 1 minute over my deadline. I still have it as a negotiator, don't I? Deadlines are just there.
How fantastic.
Oh,
Thank you. Thank you.
you are so welcome.
Cathy. That just wonderful insights. I think we could say the theme from our morning together in Carlow has been being human. And it's come up in everything we've talked about for the day. But you've added a little extra, being human in our unique bubbles. And we just sometimes don't always think about those unique bubbles. I love your seesaw in balance, and how often can we get it in balance, and your lovely guidance to help us get it into balance, and thinking about the emotional barometer. That's what helps you get your seesaw into balance. You've given us so many practical tips to take away. Thank you. I'm going to invite Fiona now to join in the conversation, and any observations you have, and anybody who'd like to pose questions, please do pop them in the chat box, and we'll watch the chat box here.
I think I'm lucky because I get to hear you twice. Because Cathy is coming into our conference in the next sort of half an hour. So I'm going to let you, who are in the audience here, ask questions, because I'll be listening to her again later on. But really interesting stuff, and so relevant to people working in fast-moving care environments. But I guess, you know, for patients, we have patients of all ages. So for somebody who's very elderly, what they consider a fast pace, I might think is very slow. Is that one of the things you have to you have to adapt your pace to the person you're managing or dealing with? Whereas I deal with pregnant women who are young and fit and healthy, and they want to get things done, they want to learn quickly. So I think part of the communication, as you're saying, is that whole emotional intelligence of recognizing who you're dealing with and where they are on their journey. So that was really helpful. Thank you. I'll be using your slides to make me think about things. Thanks.
And a further question, Cathy, how communication interweaves with quality and safety? Do you have any thoughts on that and how we think about communications when we're thinking about quality and safety?
Sure. I think if you're looking at safety, I think everyone accepts we're all human and we try our best. But I think communication is relevant everywhere, isn't there? If there's ever been an FAI, a fatal accident inquiry about anything, when you look at it, there's always communication strand. When you just need to look at anything on TV, on politics, I don't need to tell you about politics, especially with the care changes that are happening. Communication, it always sits over and above. So while the patient's safety, there's very practical measures that you all do in order to keep that on point. The communication is actually a bit like the icing on your cake. And even if it doesn't go quite right, you know, quite correctly, the communication and the quality of the communication on top of that will actually help you connect to your patients. It's all about relationships. And even some of the complaints that I spoke about that we received, when we listened to the person, they maybe felt vulnerable or unsafe or, you know, hard done by. But the big thing was communication. It wasn't so much what had happened, it was the explanation and the communication that made it all the worse. So I think in terms of safety, there's probably two strands to that, and the communication sits side by side and weaves into it quite neatly. So if you can connect, understand someone from their perspective, and maybe it's the same as our complaints. For the ones that came to us, and sometimes they've been going on for a long, long time, and you know, they were file that thick. What we did is we parked them when I went to see the person and said, allow me to park that, and I'd like to take you back to the beginning if you will, and please tell me about it. And being able to reflect and share exactly how I think they perceive the situation from their perspective in their bubble without telling them or forcing them what we were trying to do, that was the key. That was the only bit that was missing. And then when that happened, all the other stuff sort of made sense. They were willing to open their eyes and their ears to explanations once they felt heard. And I think that's maybe a bit of quality service and patient safety. Do you think? I don't know if I'm talking.
I think the other thing I thought about as well was within a team looking after patients in a very high stress environment like cardiac arrest or major surgery, really complex surgery. Like we've introduced things like the surgical pause. So that inter-team communication. And we were talking about this recently, actually yesterday I was down talking to people that during COVID, we were all masked, gowned. So you walk into say an emergency cesarean section in my job, and where I would normally before this have seen everyone I knew, everyone's wearing the exact same. So how do you know who's the anaesthetist? And you've got minutes to communicate. So the importance of we've introduced things like not just us, but across the healthcare, the surgical pause, team identity, pausing, stopping, and flattening the kind of hierarchical.
Yes.
So, for example, in a cardiac arrest, anybody in the team can make a suggestion, not just the lead of the team. So I think that kind of what you were saying about the fast communication and in a high stress environment is very much for healthcare workers, not just with the patients, but them to each other. Yeah. Massive, because the massive impact of good communication where we have a code red, for example, which is a massive hemorrhage, and when you see a well-run code red, it's like clockwork, or resuscitation of a very unwell baby. When you see a team working together where they all have the same goal, but the communication is done properly, it's achieved in a lot less stressful environment for everybody involved. So yeah, really interesting stuff. Thank you.
Thank you. Thank you both. I'd love to continue the conversation for the afternoon, but unfortunately people are at busy lunch times and we want to respect their time. I think to conclude, really, the message is communication isn't and can't be hierarchical.
No.
And I think that's a very common thread that has come through. On the screen, you'll see some resources. Cathy has mentioned our fabulous HSE communications program. So the link is there for it. Please Google, watch out, engage with the program. She's also generously shared two resources. So the Big Think film clip, and the link is there for you, and a textbook. We'll move to the next slide, Stephen. Thank you. So, in thinking about communication, the Quality and Patient Safety Directorate have developed a walk and talk improvement podcast series. And it's for you to take as we're marching and counting our steps, and they're deep conversations with people who've been involved in working in quality and safety. And the series is tied around the patient safety strategy. So the link is there for you to listen to Walk and Talk Improvement. You'll get it on Spotify or wherever you get your podcasts. The next thing we just wanted to remind you about is the perspective of education and training that's available to you, and the Quality Improvement Leadership Programme we pulled out this month for you to look at. So the link on the slide and the QR code take you directly to the prospectus. And the next slide, Stephen. Don't forget to join our QPS Ireland network map. It's social network mapping, and it's a way of seeing other people who are interested in quality and patient safety, searching for them and finding them around the country. Next slide, Stephen. Thank you. And finally, think about becoming a Q community member. Q is a membership organisation for people interested and passionate about quality and safety in Scotland, Wales, Northern Ireland, England and Ireland. The good news for you, it's free, because the HSE has a partner arrangement with the Health Foundation to make that available to staff. And my colleague Caroline Lilly-Allen's email address is there on the screen. She'd love to hear from you if you're interested in joining. Next slide, Stephen. So, before we say adieu, this is just to alert you to our next QPS Talk Time, which is coming live from the Patient Safety Office Conference next Tuesday in Dublin Castle. For those who can't be in Dublin Castle, we will be having a number of the speakers like today join us at lunchtime for people to listen and join in the conversation. And a very special webinar then on the 25th of October with Professor Mary Dixon-Wood. So dates for your diaries. So thank you for joining us this afternoon. An enormous thank you to Cathy and Fiona for taking the time out from a hugely busy conference schedule to broadcast out to you who were missing today, who can't be here with us. If you'd like to join our mailing list, Stephen, who has put all the glue together to make the technology work, will be delighted to hear from you. And thanks to Stephen and also to my colleague Shima, who's tweeting from the event today to connect with people who can't join the conference, the webinar, but can follow us on Twitter. Enjoy the rest of your lunch and thank you, everybody.